Now, let's talk a little bit. Let's talk a little bit about Twitter, and I'm going to start with Matt. I know Matt and Ryan are really big into Twitter, and I'd love to hear how you're using it and what it's best for, and maybe what are some of the drawbacks. I'm sure there's a lot of doctors right now on the phone right now, probably skeptical of Twitter. I'm not sure, but I'm guessing at least half of our audience probably hasn't even signed up for it. So I'd love to hear what you guys like about it, how you're using it, where you think it's benefiting you as a physician.
Sure. I'd say, my background is a little bit different in terms of how I got involved in social media. My interests have been less connecting with other physicians and healthcare professionals initially than learning how to interact with patients and understand what some of their concerns are outside of my clinic so that I have a better way to help them when I actually see them. And so I started off trying to learn through actually the website Dig, which is a defunct social network at this point, but a lot of it was real-time interactions and writing in forums. That brought me eventually into Twitter, and it was a little bit more confined, using 140 characters, but I found that the real-time interaction, getting to interact with a variety of people, whether it was people in my field or more likely people that were struggling with cancer, I found it just very rewarding and an easy way to learn. So I initially started getting involved in just listening first, and eventually came upon some of the tweet chats that have been very active, HCSM, and then some that are disease-specific or specialty-specific as well.
For our audience, could you define what HCSM stands for?
So health, I think it's officially standing for Health Communications and Social Media, which was developed by Dana Lewis several years ago now. It's been about 2.5 years that I've been involved in a breast cancer-specific group, BCSM, which has been very robust, very active, and has been a great way to interact with advocates, patients, a variety of healthcare professionals, both surgeons, oncologists, psychologists, and it's been just very rewarding. I've done something separate for disease-specific areas rather than interest areas, which has been for cancer care, having disease-specific hashtags that the American Society of Clinical Oncology, MD Anderson, and others have started adopting, but it's still in an early phase, and that's on Simpler in terms of where the list is. But the idea is just finding ways for people with similar interests to connect, and hashtags definitely help with that.
So, Ryan, I'd love you to expand upon that as well. That'd be great.
Yeah.
How do you see Twitter?
So, like Matt's experience, I didn't go into social media with an intent to go into social media. I went there, actually, my intent was something different, or onto Twitter specifically was something different. I wanted to start a blog for my patients and for patients who might come to see me or who might never be able to see me because they're not in the area or what have you. That would be specific to gastroenterology or esophageal disease, my specialty. And when I went to get more engagement, I went on to Twitter, and that's when I realized what was there. And Matt sort of alluded to this, it didn't just allow me to collaborate with physicians. I learned so much about the patient side of things, and I realized just how things had changed from the physician being a respected member of the community to how many patients just don't like doctors at all because of things that have happened to them. And it's this collaboration that I think we can really harness. The other thing, there's thing I've noticed on Twitter specifically is that I've had people ask me from abroad, from across the country, ask me questions, not necessarily about a specific patient, but about a question that they had. I remember a year or two ago, I keep this in my slide deck. Bobby Gaharis, one of the big docs on the Twitter sphere, asked me a question about one of my subspecialty interests that crosses our fields. He's in ENT and I'm in the esophagus, so we have a lot of things that touch one another. but other docs can ask each other questions and get that response relatively quickly. It doesn't just happen in Twitter; it can happen anywhere. But social media has really changed that.
There was a follow-up question for you, Matt, around you had mentioned that you were on a tweet chat specifically for breast cancer. Are there any other tweet ups in other disciplines, and is there any multidisciplinary tweet ups that are occurring on Twitter that you know about?
Sure. So I would say in terms of diseases, if you go to Simpler, they have a whole set of hashtags. So if you look up Simpler's Health Hashtag Project, there's a whole slew of them that are disease-specific as well as different kinds of ones that are multidisciplinary around a certain topic. The ones that I tend to participate in that are disease-specific around what I do, which is cancer care, are BCSM for breast cancer. There's one for lung cancer, LCSM. There's also another one that has been started recently, GYN-CSM. One that's been around for a while for brain tumor survivors has been going BTSM. And then it's also something I haven't done as much, maybe Miguel knows about this, is MMSM, which Mike Thompson helped get going for multiple myeloma patients. So there are a variety of these. They occur pretty regularly. Some are weekly, some are monthly or every other week. And it's a great opportunity to really get a sense for what's going on in different areas. And for me, as a general radiation oncologist, I take care of all sorts of adult cancer care patients. So I sort of cover a lot of areas, and hearing what's going on with my patients and what kinds of things they're getting in the news is very important for me, because I may find that those are conversations I'll have in my office. So I personally find that very helpful, and there is a lot of multidisciplinary involvement, some more than others. A good example that I recently came across is one UroJC, which is for urologists having a monthly journal club. Basically, they select an article, they plan on doing this globally, and they actually share a specific article, and people will comment from around the world. And so it's not all real time like some of the tweet chats where it's compressed into 1 hour, which sometimes gets a bit frenetic and it's hard to keep up with everybody. But you can actually learn a tremendous amount, and it's been a great chance for me to interact with urologists to discuss prostate cancer care, most recently in this chat, but next month it could be about something completely different. So I get to learn a lot from colleagues, both who may be in the same area of interest but may have a completely different perspective from mine, that helps me when I get back to dealing with patients in real life. I would say one other nice thing about it is you don't actually have to participate and tweet to still appreciate it. If you put into the search function the hashtag that you want to follow, because then you can just quote-unquote lurk, which means you can actually learn something and you don't have to participate.